Dr. Jeremy here, and I'm a chiropractor at the house at New Malden Clinic. And today I'm going to be showing you the top 3 ways that we use to get our clients out of sciatic pain quickly and effectively. So following a thorough assessment here in the clinic, we're going to understand exactly where the sciatic nerve is trapped and where the patient is suffering from the pain. And each time the client presents to the clinic, we're going to assess them to see how the pelvis is orientated so we know how to manage it. The first technique we use is something called sacral occipital technique, which is a light blocking technique to shift the pelvis back into a neutral position and take the pressure off the sciatic nerve. So this is one of our clients here, and each time they present, we'll check the state of the pelvis, the sciatic nerve, all the way down the spine, and the soft tissues surrounding the pelvis as well. And we use these blocks, these triangular blocks here, to put under different points on the pelvis and breathe very gently through your tummy. We'll leave the client on these blocks for up to a minute at a time and then check afterwards to make sure the pelvis is orientated back to neutral to relieve the sciatic pain which is going down the legs. So the sciatic nerve stems from the lower part of the spine down through here and goes down both legs all the way to the soles of the feet. Now some of our clients can be suffering with sciatic pain down both legs or one leg separately. So what I'll do is I'll show you what we do for the single leg sciatic pain by releasing off some of the muscles around there. People can often be feeling a lot of pain in a muscle called the piriformis, which is just on the top of the hip through here, or the gluteal muscles, which is this area through here as well, can often be very tender, and then shooting pain down into the legs. Now, one of the techniques we use is called trigger point therapy, which is a very gentle technique just into the muscles and slowly rotating the hip around. We find tender spots in the muscle where there's a lot of contractility in the muscle, and we apply light pressure with our thumbs to reduce the pressure on the muscles, and it helps to relieve the sciatic pain. So we also use something called an activator. Now this is a spring-loaded instrument which is very gentle and also works into the trigger points around the piriformis area and the gluteals. So again, we'll find a trigger point within the muscle, very gently apply the activator, which makes a small clicking sound, retest the trigger point, and move on to the next one. This reduces the tension on the muscle and takes away the trigger points from the areas that the sciatic nerve is running through. And the third thing we do is something called a spinal adjustment. The sciatic nerve comes out the base of the spine down through here. When we adjust these bones, it takes the pressure off the nerves to get the client feeling better much more quickly. It's very gentle, it's very quick, and there may be a clicking sound. The clicking sound is just gas being released from the joints. And it's as simple as that. This moves the bone, take the pressure off the nerve, and the client usually feels a lot of relief after that when the pressure is gone. So if you think we can help with your sciatic pain, then call this number on this page, and if you quote this video to the receptionist, they will give you a complimentary assessment with myself, Jeremy, at the house at New Malden Clinic. Many thanks.